Hello, hello, and welcome to today's podcast. Today, we are talking about constipation.
Yep, very common problem. Very, very common problem. It happens with a lot of individuals, and it creates a lot of metabolic problems and disease and chronic disease processes. So it's not just feeling full and bloated and having a hard stool. It's something that creates a lot of chronic disease, which can lead to problems for folks. And we'll discuss all that today.
Yeah, and really, it's just one of those things that just makes people feel uncomfortable. It's just,
Yeah,
you don't feel good when you're not having
right.
proper bowel movements.
Bloated, gassy. Basically, it's the definition is someone that has fewer than 3 bowel movements in a week. And, it's certainly something that, yes, there can be irregularities that occur, whether it be traveling or, change in diets and things like that. Of course, we'll discuss all that. But in general, people that consistently have these kinds of problems, we have patients that will go days without bowel movements, and that's the norm for them. And that's just not normal. So,
Yes,
but
common,
yeah,
not normal.
but 16% of adults will suffer from constipation. And the older we get, the harder it is for us to have these problems. And at least it basically doubles the amount of, when you get to be 60, you're going to be having greater than 33% of the adults will have problems with constipation. So it's pretty significant.
Yeah, so when you're constipated, you're dealing with hard, dry, lumpy stools. Conversely, an ideal bowel movement is soft, well-formed, and easy to pass. And you are eliminating completely. So you feel like you have completely eliminated when you're done.
Right, right. And it's certainly something that, also women have more troubles with than men, because of hormone fluctuations that they actually have. So it's certainly something that contributes to that a little bit more for women.
So some of the causes for constipation. Number one, I would say, is probably the standard American diet. Lots of ultra processed foods that are high in refined sugars and low in fiber.
Yeah, this awful diet that we are exposed to on a regular basis is just a major contributing thing to a lot of problems. But constipation is one of those, obviously, that has that side effect. But it's just we have such a poor nutrition with lack of proper nutrients and lack of fiber. Fiber is just essential for forming stool essentially for us.
Yeah.
So
And Dr. Mark alluded to it already a little bit, but hormone imbalances for women, estrogen and progesterone, a lot of women will experience during a certain time of their cycle. They'll have different bowel habits, and that is due to hormones and how they're fluctuating throughout the cycle. Cortisol can affect the bowel and thyroid as well. So thyroid dysfunction is
a lot of folks think that that constipation is a normal thing, but it's not. I mean, when you look at it too, going back just a minute for a second on our fiber, I mean, fewer than 5% of the people get the daily recommended amount of fiber, which is 35 grams of fiber in a day. And it's certainly something that because of our diet, we just don't get that. But with the thyroid, that's something that can be kind of sneaky. Now, we may have we've had a lot of discussion about thyroid disease and hypothyroidism and suboptimal thyroid. So, but of the individuals that truly get diagnosed from their PCPs or their healthcare provider with hypothyroidism, that's 5%. And they're just literally undiagnosed. They're just walking around with low thyroid levels, hormone levels that are truly measurably low. And they're not being treated. And that's the contributing cause for the constipation for folks. So, but another big one is exercise. We are a sedentary group of folks that we just don't get good enough movement. And, sedentary people are 40% more likely to have chronic constipation problems than non-sedentary folks.
yeah, that's a big
Yeah.
big deal. I think the next cause on our list is sleep disruption. And when you're not getting good sleep, your gut doesn't have time to like rest and digest. I mean,
Right.
that's what sleep is part of what sleep does for us. So when we're not getting the sleep that we need, our body doesn't have the time and the ability to really
digest,
move that
properly.
along.
Right. So, as you can see, there's a lot of contributing factors that lead to this situation. But that sleep deprivation, I mean, yes, that causes problems with stress hormones, and those will also worsen our problems for people too. But, let's look at the connection. Let's look at this gut connection to chronic constipation. Dysbiosis, that affects the balance of the natural bacteria in our gut. We can have a lot of issues there with that disruption. And when you disrupt that, it takes a while to get that back in check again. And there's a lot of things contributing to that, whether it be our diet or medications or sedentary lifestyles or hormone imbalances. So it affects a lot of that.
Yeah, and malabsorption along with that. And two of the nutrients that are really affected by that malabsorption, just two of the many, but magnesium and B12. And we all know that those are really hot nutrients right now. We're hearing a lot about magnesium and all the different things that it can do for us.
So many people are deficient in that.
Yeah. And B12 has a huge impact on our energy.
Yeah, exactly. But, those bacteria help us out a lot in the gut, and they take that fiber and create a lot of things that we just can't digest and can't absorb. So that's very helpful for that, to create that good natural dysbiosis, to reduce that dysbiosis, that is, actually. So other issues, we can have problems with constipation creating hemorrhoids or anal fissures. Those things are kind of now you've created another problem. You created other issues from having to strain continuously. So that's a downstream effect. And, diverticulosis affects a lot of adults. Stats, 35% of adults over 50 and 70% of adults over 80. So it's pretty significant. That's a contributing problem to a lot of GI symptoms for adults.
And then systemic effects that constipation can have. When you're not properly eliminating, you've got toxic reabsorption. So your systemic inflammation and immune load is overtaxed. And
right, yeah, it's certainly interesting. When you start having the chronic inflammatory states too, that affects everything from heart disease to type 2 diabetes to autoimmune disorders, you name it. And it's certainly, chronic inflammation is contributable to a large number, a majority of the deaths out there, actually. So, it's something to keep in mind. And mental health. My goodness, you wouldn't think that being constipated would cause problems with mental health, but it does. You've got, there's a lot of numbers out there, but 70 to 90% of our serotonin in our system is created by our gut. And, that's a mood regulator, mood stabilizer, basically, for us. So we'll have these mental health disorders that can be contributable to that depression and things of that nature, which lead back to gut dysbiosis.
Yeah. So if you are constipated, you are 2 to 3 times more likely to suffer from depression or anxiety. Yeah. That's pretty big.
Yeah. It's kind of crazy to think that. And of course, other serious conditions that kind of play into this too are colorectal colorectal cancer. That's something that also is a prolonged exposure to constipation can be contributable to that.
SIBO is another disorder.
Small intestinal. Yep. Bacterial. Say it with me.
Up to 60% of constipation dominant IBS patients also have SIBO, which leads to lots of other things.
Yeah, it's crazy. And then, of course, it affects our cardiac system, our cardiopulmonary system too, cardiac strain. We're having elevated blood pressures and straining, and all. So that it's quite interesting that I thought it quite interesting that this, one of the stats that I saw was, 20% of the people that suffer a heart attack have had a pre-existing history of straining with constipation prior to that heart attack, which I don't know who came up with that statistic, but that's where we found that statistic. Certainly, I would think that would be an interesting thing to look at and measure, but certainly some of it makes sense, at least in that respect. So
wasn't that Elvis, right?
I don't know. I don't know. That's a good question. that might be a topic for another podcast.
I don't know. I'm just pulling stuff out of the records.
But the immune system is very, very well associated with our gut health too, and constipation. So, 70% of our immune system is located in our gut, this gut associated lymphoid tissue. So when you start having, issues with constipation or dysbiosis, well, then that's going to affect the way that your immune system fights infection, or your body fights infection. So it can lead to a lot of issues, and even autoimmune diseases, significant autoimmune diseases.
Yeah, and the toxic reabsorption is also affecting your immune system when you're not getting rid of that regularly.
Mm-hmm. Right, exactly. So, when you have gut imbalances, you're going to be more likely, even up to 40% likely, to have these chronic infections that you can experience. So, and there's a lot of sources for these infections, so a lot of reasonings for them, but it can be anything from skin infections to sinus infections, even, believe it or not. So it's true. So what are our treatment options? There's a lot of options, a lot of things we've touched on with this. What just starts at the beginning, the top of the list, is nutrition. Nutrition is certainly something that very significant of an impact to it. And that's from absorption, dietary fibers to, fruits and whole grains and vegetables and things of that nature too. So, but, we just really want to stay hydrated. We really want to stay hydrated and increase our fiber. So we're going to get that 35 grams of fiber a day is really where we want to shoot for.
Yeah. And as far as water goes, you want to shoot for 1 ounce per half of your body weight.
Body weight.
Ounce, number of ounces.
Per pound of ideal body weight.
Yes, half.
Yeah, that's important. We all don't get enough fluids, that's for sure. But balancing our hormones is also a very important thing. And that can be anything from estrogen, progesterone, testosterone, thyroid. Those things have to be in balance. And when they're not in balance, then we're going to experience these types of constipation issues potentially. That can lead to that.
And then there are tools to regulate your stress hormones: meditation, yoga, movement, adaptogenic herbs.
Mm-hmm. Yeah. So there's a lot of things like that. Ashwagandha is good for that. Exercise. We can't stress that enough. If you could have two things in the world that you could fix to help improve your chronic health and your condition, it would be exercise and nutrition. You got to have the right nutrition, you got to have the right exercise, but exercise is just so key to helping improve everything from your mood to your GI tract to, you name it, type 2 diabetes. So it's very important. And then we try to get a good 20. I always suggest people do 20 to 30 minutes a day. Try to do something.
And this isn't, we're not talking here about like crazy exercise. We're just talking about like get out for a walk, or, and it doesn't have to be all at the same time. You can do these in little exercise snacks and, do 10 minutes here and 10 minutes there, and,
Yeah, or even 3 minutes. Commercials. Go to a commercial break for a couple minutes and do some exercises. Sit there and do nothing when you can actually get up and actually do some squats or something of that nature, or go to the refrigerator and find something you want to drink. But that's movement. That's exercise.
Yes. And if you have the opportunity at work, if you have a desk job, if you can have a standing desk,
right,
and do some movement throughout the day, that's fantastic too.
Little things is important too. Is don't park the closest you can to the door. Park farthest away you can in the parking lot, so that you have to literally use another minute or two of time to get back and forth to the car. That also is movement and exercise. So set yourself up for success by trying to think ahead and create that. Yeah, it gets cold, or maybe it's raining, but maybe you're going to run or walk a little faster, so it won't hurt that either, probably.
And then sleep is the next thing. We need to be getting 7 to 9 hours
consistently.
Yes. So whatever you need to do to be getting that consistent sleep will really help to improve your gut health. And, we have another podcast that talks about sleep hygiene and the things that you can do. And certainly, I'm sure we can talk about it again, as there's always new things and ideas.
Oh, yeah. We'll continue to reiterate all the same stuff over and over again, it seems like. mag citrate, magnesium citrate. There's a magnesium thing again. So magnesium is very important for that. So that also helps with everything from our mood to our cellular health to, yes, our GI tract.
Yes. And I think magnesium is, I'll just put this pearl in because we already talked about the fact that magnesium is a hot topic. But there are several different types of magnesium, and each one kind of has its main role. Yeah. So be sure that if you're going to get a supplement for magnesium, like, do a little research and know what type to look for what you're looking to help.
Right. And, probiotics, that's certainly something that is very important and very helpful because of our poor diets and our sedentary lifestyles. We create this constipation, the dysbiosis. And so now we have a decrease in the good bacteria that we actually need in our system, so there's a lot of new topics, but, Akkermansia is one that's out there. Lactobacillus, bifidobacteria, those types of things are very important. And there are supplements, there are probiotics that do focus on those with different concentrations, and they will help improve and reduce your leaky gut issues. So we don't want the malabsorption issue is certainly a problem.
Yeah. And probiotics get a lot of talk, and prebiotics are really important too. And part of that prebiotic is the fiber that will the probiotics
You
are
got to feed the bacteria.
Yeah.
You got to give them something to eat. So, but all our lifestyle tips, I think we talked about pretty well. Just kind of going over the hydration and the fiber, and then the exercise and getting up and move. After a meal is a really good thing to do too for movement. So that keeps the GI tract going. It'll reduce your glucose spikes also. So it's going to be very helpful for a lot of things for people. But these relaxation techniques to reduce stress is also highly successful for people.
Sure.
So basically to wrap everything up, I mean, we've talked a lot about a lot of things, and certainly, there's little things that people can do. There's things that that you don't do right, or maybe don't do well enough, or maybe that you can improve a little bit better. So I think if we just kind of take little parts and pieces of these things and try to implement those in your daily habits and activities and your nutrition, I think that'll help us a lot to improve that, reduce that constipation. And of course, when you have issues with your dog that's wanting to get attention right now, so that is an issue too. So, but reducing stress is talking about stress. Reducing stress is also highly important.
Yes. And I think just remember that the topic of constipation feels like you're just talking about poop, but it's really so much more than that. It really does affect your immunity, your mental health, systemic inflammation, all of those things. So it is a big deal. And a lot of people, I think, it's not a big deal. And maybe that's not the worst of your problems, but maybe it is.
Right. So, but anyway, I hope you've enjoyed a little bit of conversation about constipation today. So we certainly are here for any questions or comments, or if you'd like to have anything special that we would talk about on podcast, reach out to us. We'd be happy to help you out with that at Revelation Health and Wellbeing.
Yep. We'll see you next time.
Have a healthy day.